I work at a clinic called She Integrated Health, as Christian said. It's up on West Broadway at Trafalgar, and the focus of my practice is athletic injuries and muscle and joint pain. So I'm going to start this evening by giving you a case presentation. Then I'm going to talk about how I use acupuncture in my practice and what my patients can expect from a treatment. And then I'm going to go into talking about specific conditions that I treat with acupuncture. And then we'll do a quick demonstration at the end. So I had this case come to me a couple years ago, a 24-year-old male runner who developed shin splints. And he started off with getting just some sort of aching along the anterior aspect of his tibia, so right along here. And that was coming on anytime he was doing activity, especially with running or jumping. So that went on for a little bit, and then he started getting a little bit of swelling, and then it was now this ache, and he couldn't really do any activity, and he was really looking forward to doing this run. So he came to see me to see if acupuncture would be able to help, because he really wanted to do this race. So he came to see me. I did orthopedic testing on him, and he tested positive where I thought that he would. And so I did an acupuncture treatment on him, and he had fantastic results, pain relief right away after the first treatment. So I sent him home with a few stretches and some exercises that he could do, and then I recommended that he also look into his footwear to see if that was maybe part of the cause of his problem. So then he came back 3 days later. He saw me for one more treatment, and that weekend he went and ran a 10K race and had no pain during or after the race, and that was it. He was good. He didn't need to come back and see me again after that. So typically with shin splints, this is something that it's really painful. People don't like it. They want to get rid of it right away. But acupuncture normally takes about 2 to 4 treatments over a 2-week period, but this is just an example of a case that had amazing results. This is also a great example of where Western medicine will typically say, go home, rest, put some ice on it, take some anti-inflammatories, and that's pretty much what we can do for you. So acupuncture is something that just has that great added benefit to help people where Western medicine might be lacking a little bit. So if a patient was to come and see me for a treatment, I would start off by doing orthopedic testing, muscle testing, just to pinpoint where the injury is happening. Then I would do some acupuncture either directly on the area or the surrounding area, depending on the condition. And then I'll use this little machine here. It's called an electric stim machine. And we just attach these tiny little electrodes to the needles, and it sends this little wave of electricity. And that just helps to release some of the trigger points, and it also helps bring blood flow to the area to help with the healing process. And then with my foundation in kinesiology, I will provide my patients with therapeutic exercises where I see fit. But if something is beyond my scope of practice, I've spent a lot of time working with physiotherapists, occupational therapists, personal trainers, so I know my limits, and I'm definitely looking to refer to other healthcare professionals when I think my patients could use more help where I can't help them. And with that said, there are specific healthcare professionals that I am currently seeking out to refer to my patients. We can chat about that at the end. So examples of some conditions that respond really well to acupuncture: shoulder injuries, any sort of rotator cuff injury, the acromioclavicular joint in your shoulder here, the SI joint in the back, tendinitis, strained sprains. Those all respond really well to acupuncture. Examples of cases that respond well to treatment, but it takes a little bit longer, are things like neck pain, back pain. those can be a little bit trickier to diagnose, and the healing process is usually a little bit longer with those. And then if someone was to come to me with, say, a torn meniscus or a tear of a ligament or something, anything that's close to requiring surgery, acupuncture is probably not going to be able to help them very well with that. Is there anyone here who wants to try acupuncture who's never tried it before?
That's a good question.
Yeah? Okay,
James?
a couple people, yeah. So is there a reason that you've never tried it before? Is it that you just never came across it, or you were worried that it might be painful?
I've always used acupressure, not acupuncture.
Okay. So it's just something that you never really had the opportunity to try before. Were you ever worried that it would be painful?
No.
Okay. Is there anyone here who's worried that it would be painful? Maybe I'll have to demonstrate on all those people. So these are the needles that I use. They're all individually prepackaged, one-time use, super tiny. So usually when people think of needles, they think something that's the size of a needle that's going to be injecting something, and those likely are going to produce a little bit of pain. But with these ones here, they're so tiny, usually the patient just feels a little bit of pressure or distension in the area, and that's pretty much it. So would you be willing to let me do a demonstration on you?
Yes.
Okay.
Five more inches.
Why are you taking them out so quickly?
Well, it is.
Because it's a demo.
Oh, just I see.
Yeah. Normally I would leave them in for about 20 minutes.